we talked about snake-transmitted helminth and waterborne transmitted helminth, helminthiasis. Now, I would like to talk about soil-transmitted helminth. It means that the soil, infested soil and polluted soil with nematode eggs is responsible for infection transmission. Okay? So, we talked about trematodes. Now, this is the term for nematodes. The most important one, which undoubtedly is the first important helminth infection, nematode infection in the world cosmopolitan, is Ascaris lumbricoides. Roundworm. Roundworm or Ascaris lumbricoides, please. Okay. Synonym: large roundworm of the small intestine, Lumbricus terrestrial. In morphology, they are resembled to free-living worms that are living in the soil, but they are not parasites. Fishermen can get them and as a bite for the fishing and something. So the similarity in feature, I mean, this is the around 20 to 30, 40 centimeter in length, and the male and the female are separate from each other. And as you can see here, gutworms, soil-transmitted helminth, and the worms that live in the intestine from the beginning of the small intestine up to the near the ileum, for instance. And for soil-transmitted helminth, roundworms like Ascaris lumbricoides, hookworms, and whipworms. Whipworms is Trichuris trichura, Trichuris trichura, and for hookworm, Ankylostoma duodenale, and Necator americanus. All these three types of worms are soil-transmitted helminths. Okay, this is the picture. This is for this is the cross-section of the worm to show you that they have not a mesenchymal part. They are, this is the skin wall. This is the skin of the worm, nematode, cuticle, and all organelles inside the worm is just tube into tubes. So parenchyma is not exist here. And in the top right, you can see three lips of the Ascaris electron microscopy, and this is for drawing tube and showing you the lips. It means that no invasive tools like hook or something they have not. And you can see that esophagus is here, what is very important. And this is the natural appearance of the worm when you get out and put it into the petri dish or something. And this is the external part of the feet of the male worms, equipped with two espicules. Espicules are accessory organelles for copulation, and this is to show you that when I say the organelles are tube into tube, if you cut longitudinally Ascaris worm, you can see that ovary and also intestine, all of them are inside the tube. So just to show you the morphology of the nematodes in general and Ascaris lumbricoides. The largest intestinal nematode has educated causative agent of ascariasis, distribution worldwide, everywhere, and habitat small intestine. Just with one information, with one sentence, I would like to tell you that what is the condition of this parasite infection in Iran since 50 years ago till now. Around 1970, you could go to Isfahan province or Hamadan province, and you find unexpectedly 80% of rural area infected with Ascaris labialicoides. It means that 80% of people in these hyperendemic areas were carrying Ascaris labialicoides in their small intestine. But now, even one case I could not find, because our laboratory in Tehran University of Medical Sciences is the central laboratory and referral laboratory. We have to know about this information. So the matter is that two very important matters has happened, and then after the infection is disappeared. One is infrastructure for environmental hygiene, sewage system, and then after fertilizing material for farmers. And along with these two very important points is the health education and the level of education among the people. Okay, so next slide. Epidemiology and geographical distribution. Cosmopolitan means you can find it everywhere in the world. Tropics and subtropics. 1 billion people in tropics and subtropics are at risk or involved with this parasitic infection. Although this information is not very up to date, but even nowadays, if you go to Southeast Asia, and if you go to African continent, African countries, and many places in the world, you can find in poor region in the world, you can find that still plenty of people are carrying this parasite. Anyhow, this data is for I think 15 years ago. Anyhow, very important. 1 billion people. Asia 73%, Africa 30%. Why in Africa is 13%, but in Asia is 73%? Why?
Does Asia has the most population?
No.
Agriculture is more in Asia.
No.
Because of temperature, weather?
Exactly.
Drop.
Because the temperature and the environmental condition cannot support the leaving of the eggs or saving the life of the eggs into the nature. In Africa, because of dry situation, they become at the beginning of the expelled from the feces on the ground. They become dry. So, but the other matter is the population, yes, but not when we compare it. Can we say as a third factor?
What's the difference between the weather in Africa and Asia? Like,
What?
there is no like big difference between the weather between Asia and Africa. So why it's like?
No, when we talk about this huge number of predicted cases, it means that when you go to Africa, for instance, the living condition and when they are gathered to get together, and for instance, humidity is the most one, because when you go to Southeast Asia, the humidity in some places is general. But in Africa, you can find some places very dried, and also with no desert area. And when you look at the life cycle picture, then after, as we talked in previous sessions, okay, you can guess that you can say that what is the most important factor in this prevalence. Anyhow, you see in USA, in agricultural region, okay, and in South and Central America, just 8%. This is not because of climatological factor. This is for just, let me say that the level of scientific environmental hygiene and something. So, life cycle. The worms are in the small intestine of human. This is not zoonotic. The only definitive host, the only host we can call for Ascaris lumbricoides is human. In intermediate host, we have nothing here. Just this is a soil transmitted helminth. Okay, eggs by feces go out and they have to stay in the environment in appropriate condition with enough humidity, far from direct sun shining. Okay, they can stay for some days to become infective. Why? What we call infective inside the egg when they become released from the female in the intestine of the human, they are not enough capable to transmit infection. They have to stay in the appropriate condition in the environment to become fertile, and after that, to become infective. And with this condition, when they become infective, a larvae form inside the eggs when contaminated hands with soil or raw vegetables containing of these eggs, they can be the cause of transmitting infection. You are with us or not? You are with us?
Doctor, would they count the Burkians? Would they count as advanced parasites because they have digestive system?
What?
The roundworms. Would they consider the advanced parasites?
What means advanced?
As in like better than the others because they have a digestive system?
They are digestive system. No, you are watching here the respiratory system, for instance. No, I will tell you what is the cause of this picture. Because this infection is disturbing two parts in the body. In the beginning, in the life cycle, you can hear that at the beginning, the respiratory system become involved, and then after they become mature and come to the digestive tract. No, I will talk. Anyhow, so this is the condition, the general situation for life cycle of Ascaris lumbricoides. Adult worms live in the lumen of the small intestine. Unfertilized eggs may be ingested but are not infective. For instance, if you imagine that at the beginning of expelling the eggs from the females and they are in the environment, and if suddenly or accidentally we ingest these eggs, they are not infective, they are not capable to infect us. So they have to spend 2-3 weeks into the environment to become infective. Larvae form inside the eggshell. This is very important. Anyhow, after the infective eggs are swallowed, the larvae hatch, invade the intestine. This is after 2-3 weeks after expelling from the females, the female worms. So if we ingest them in the pH of stomach, they become changed, and the wall of the eggs in the beginning of the small intestine hatch. The larvae hatch from the eggs, and larvae are very, very small juvenile worm into the small intestine. But they do not stay over there. They try to penetrate the intestinal wall and go to the blood circulation, which the life cycle of parasite become continued. Okay. In this phase, they try to go to the liver and write part of the heart, and then after they pump it to the respiratory system, and they try to go through the circulation, and the terminal phase here is the alveoli, the microville, the very, very the blood circulation around the vessels, around the alveoli, they enter up to that place. And in this time, the diameter and the length of the larvae are enough suitable to stay there. And they start to develop. And when the size becomes larger, they undoubtedly they have to penetrate the alveoli wall and enter to the respiratory canals and tubes, okay? And then after some hours and after some days, you with reflex mechanical and with coughing and something, you can get them up and again swung to the intestinal wall, intestinal tract for the second time. So for the second time, they enter to the digestive tract. In this time, they are enough resistant to the pH of the digestive tract. This is very important. And in the beginning of the small intestine, they stay over there for some weeks and months and become adult. So the beginning, at the beginning stage, the size was very small, and they went to the circulatory system around the alveoli, and then after, now they are in the small intestine. They have not any instrument to attach themselves to the wall of the intestine, but their muscles are very enough strong to keep them live and to keep them not to move from the intestinal tract until they become adult. Now, at this time, you can understand that we have two clinical symptoms. Respiratory one and intestinal. In respiratory one, we say Loeffler syndrome. Eosinophilia is very highlighted here. I will talk about that. And in intestinal phase, just they are living over there and let me say that just getting material, food items from the intestine of the patient is the only one, and if the number of worms are very few, 1, 2, the patient can resist, and thereafter, if the number of plenty, intestinal obstruction may happen or intestinal perfusion may happen.
Do we have also like clinical relevance related to the cardiovascular system?
Cardiovascular, yes. But the cardiovascular system, the affection, you mean, the disturbance, or no. They just, in the beginning of the phase of where they are very small size in the larvae in morphology in size, just they pump to the respiratory system and then after. Cardiovascular, no. Okay, let me go for another one. Coughing, wheezing, dyspnea, low-grade fever, cyanosis, tachycardia, pressure or pain over the chest, mucoid or bloody sputum, transient eosinophilia, numerous eosinophilia in the sputum. This is the clinical symptoms and signs in the respiratory phase. We say Loeffler's syndrome, or another more specific definition is pulmonary eosinophilic infiltration. Why we have eosinophilia here?
Because they live in the tissue.
Yes, invasion to the tissue. Which tissues? Pulmonary system. Alveoli, the wall become penetrated. Okay, so this is very important to take into account that Loeffler syndrome is a disease in which eosinophils accumulate in the lung in response to a parasitic infection. Imagine this amount of worms are living in the small intestine. Intestinal obstruction is very easy to expect. Nowadays, if you find in very specific and accidental condition one patient or one parasitic parasitosis, okay, it means that the number of worms are not so many. This is very easy to say that 50 years ago, when you go to rural area, endemic rural area, even in rural areas around Isfahan, for instance, the number of cases were carrying such number of parasites. We have a museum in our health research station in Isfahan, and you can find that a box of the worms kept informally for just one patient, nearly 70 worms, nearly 100 worms.
Did they remove it by surgical procedure?
No, you see, it was the time of all physicians and all health workers were aware about such condition. Okay, they was trying to treat the people, and they were excelling numbers of eggs after the treatment. And in surgical matter, if unwillingly for urgent operation, they submitted to the operation room, surgeon was saying that the intestine is full of worms. That's it. And I have heard from one of our late professor, peace be upon him, that he was a pediatrician, I think. And he told us at class that nearly 40 years ago, they were facing to a pregnant woman. And they thought that she was pregnant indeed. After 9 months, after 10 months, no sign. And when she brought to the hospital under the surgery and in laparatomy, they found that nearly 100 worms is in the intestine, and something happened to the woman. So, and it became surgery, and the worms.
Does it also invade the tissue of the mucus of the intestine, or just stay inside there?
When you imagine 100 worms are staying in the intestine, what will be expected? Obstruction, narrowing of the wall of the intestine.
So
They cannot absorb something, okay? So at the age of growing in the very hyper-endemic areas, the young people, the children, at the age of growing, okay, they cannot absorb material.
So one of the symptoms.
No,
should
please,
be-
let me finish, and then after write the question. Do you know why? Because we take the time. It's not everything you are talking about. This I will mention it, and then after, if this is questionable, you can ask me. The important is that according to FAO, the organization for helping poor countries material or feeding items, food items, according to one report, I heard that the matter, the amount of the volume of donation of food from FAO to other poor countries was equal with the material that Ascaris lumbricoides were eaten from the patients, from the host. Imagine how important matter the world was facing to. And shortened crypt depth. This is why I ask you and I to wait and then after. You see, shortened crypt depth, decreased venous length, decreased number of goblet cell per number of gastrointestinal epithelial mucosal cell. muscular hypertrophy of the gastrointestinal lamina muscularis. All of these clinical symptoms and pathological appearance is due to large number of worms inside the intestinal lumen. So that's all. Symptoms of scoliosis. No symptoms. Stage 1. Worm larvae is in the bowel attached to bowel wall. Stage 2. Worm larvae migrate into the lung. Maybe some of these larvae cannot enter through the intestinal wall and go to the circulating, blood circulating system. Fever and breathing difficulty, coughing and pneumonia. What was the name of this phase? Loeffler syndrome, okay? But for abdominal symptoms, abdominal discomfort, 1, 2, 3, 4 worms or more of them, we are facing to abdominal discomfort. Intestinal blockage may be partial or complete. Partial intestinal blockage, total blockage, severe abdominal pain, vomiting, restlessness. This is a question we can ask from ourselves. At this time, when the people are looking for beauties, right, they go to the surgeons for cutting something here or I don't know for this part and to make them very, very beautiful, okay? Is it possible to find somebody with 100 of ascaris vulgoides and go for rhinoplasty, for instance? No. So this is very important that by over the time, the very not medical changes in the communities. For instance, we have term is as SDH, social determinant of health. Social determinant of health. When the people are facing to this, their mobile phone and laptops, and they have access from Africa to the United States, from Iran to other countries, news is distributing just in few minutes, okay? At this level of technology, it's very unusual, very strange to find somebody carrying hundreds of worms and nobody knows about that. This is very important. At that time, I remember my father was working in the malaria section in the Ministry of Health, and they were going to all villages in Iran to find the people and to register them and to take them treatment. Now the patients are looking for somewhere. The patient, you can find it, travel everywhere in Iran to visit a reliable doctor for getting enough treatment. But at that time, I remember that, again, one of our professors told me that at the class, when they went to a very highland village on that places, okay, with vehicles, what four-wheel drive one on that time, village jeep in with their work, the villagers who were not seen automobile before that time, okay, they brought vegetable and something in front of the jeep because they thought that maybe jeep needs something to eat. So, although it is not very definite story, but the situation, when we compare it, it's possible. And in endemic areas, 35% of intestinal obstructions was recorded due to Ascaris vulgoides. Extraintestinal complication, ectopic one, wandering worm, and locating in unusual and unnormal place. One thing, Ascariasis migrate through ampulla of water. Imagine in the small intestine, the patient is harboring 40 worms. They are not just freeze in a very in their own size, but they can move. They can go through ampulla of water, and maybe suddenly you find it in the gallbladder, and they invade other organs. Maybe they go to the appendix, and acute appendicitis will happen. This is very important. In some cases, the worms go out and comes out from the ear and nose and mouth. We have heard so many stories about even our relatives in some places when they had visit, okay, they saw that somebody is saying that, okay, something is going out, and they saw that worms are come out from the mouth. And like the other in very high burden of worm in accidental situation. Okay, phoretic process. But phoretic, what is phoretic? This is clean, apparently. Okay, maybe somebody who is here and have some bacteria in on its hand, okay, and touch it, and then after you come after you can go and get it. When you get the bacteria from this way, from this instrument, okay, it means that this instrument was in phoretic process transmits such bacteria to you. In the small intestine, when the worms are residing over there and their skin is full of bacteria, the bacteria that are not, they are useful even for digestive tract, and if the worm comes to the ampulla water or come to the lumen of appendix, these type of bacteria are not suitable for this new location. So sepsis and other infectious, infective, secondary infection can happen, and we describe it as phoretic phorecy process, severe or fatal suppurative complications via extra-intestinal migration of the worms. They carry bacteria by themselves to new sites, to ampulla water, to gallbladder, to abdominal cavity. Laboratory diagnosis, finding eggs in feces. Macroscopic identification of adults passed in stool or through the mouth of nose. This is not for the cases carrying 1 or 2 worms. This is for those who carry hundreds of worms. Some of them comes from, we don't need a very high IQ here to diagnose, oh, he or she is infected with Ascaris lambricoides. Do you know why? Because the worms are coming out. So, fortunately, everybody can diagnose it. And for the other, even maybe during the defecation, the mother the mother see that their children is infected with Ascaris lambricoides. A stool microscopy, we have to see the eggs of Ascaris lambricoides inside the feces, but the type of eggs are not infected one. They have to go and spend time into the environment to become infected. And for eosinophilia can be found, particularly during larval migration. The concentration method is very important. Formal ether concentration. 5 grams of stool is thrown in the formalin, and then after by adding ether and something, and then after centrifuge and making this amount of very small amount of feces concentrated, and you can find eggs inside this sediment material very easily. 3 types of eggs of Ascaris labricoides. This is the typical one. This is the typical one. Fertile eggs. When female worm and male worm is existed in the intestinal tract, they copulate, and the eggs after this copulation become fertile. This is fertile. This is unfertile. When the male worms are not existed inside the intestinal tract. So the uterus of the female worm is full of eggs, but all of them are not fertile and they are unfertile. This is the corticated eggs. Due to the material the patients eats, the diet and something, and the number of worms are plenty, so the eggs are in contact with each other, and maybe the outer shell of the eggs are not formed, and you have decorticated eggs. Unfertile one is much larger, around 88 to 90 micrometer, and for fertile one, they are nearly 40 micrometer in size. For treatment, forget mebendazole, piperazine citrate, pyrantel palmate. The most up-to-date treatment and most effective one, the new generation of treatment is albendazole, 400 mg, single dose for each year, in each age group. You have to just look for pregnancy. If the mother is pregnant, you have to be very conscious for treatment of this infection. So albendazole, 400 milligram as a single dose is enough for treatment. On that time, the treatment was very difficult, because you can see here on the picture that when you prescribe piperazine, for instance, or alcopar, very bad tasty drug at that time, you had to prescribe laxative material for the patient enough to become free for expelling the worms. And on very bad situation, maybe when you prescribe the drugs without the laxative material, abstraction could be happen over there. So the important is that this new generation of treatment have enough material to support this weakness. Prevention. I'm sure that all of you can understand now what is the measures for preventing, to avoid getting ascariasis. Keeping good sanitation conditions is the only way to prevent the infection of ascariasis. Pollution of soil with human feces. Pollution, the soil with human feces, is not here to tell you accidentally. Maybe they used the feces of humans for fertilizing material, for fertilizing purposes. The farmers were going to buy the feces of the people in the town, in the village, from those who was carrying the feces from the well of the toilets and as fertilizer. It was very important. But vegetable should be truly washed in a mild solution of potassium and something. But the important is that when on that situation, you have to be very conscious about raw vegetable material, even tomato, apricot, and something like that. So it was very important to be confirmed, to be enough confident that the eggs are washed from the surface of the vegetable. Here, hands should be properly washed. I remember even 30 years ago, 35 years ago, when the health workers had mission to their location in villages area, swab was something to give as a prescription for villagers and for pregnant women, mothers. It was very important. But now you can see that this solution for washing the hands and in shampoo and something is, if you go to an even far villages, okay, you can see into the garbage several brands of shampoo and soap. This is solved, and by this non-targeted measure, you can see that several diseases are eradicated. Soil system. The name of the feces for fertilizing purpose is night soil. Human excrement collected at night from buckets, cesspools, and for fertilizing in the agricultural field is night soil. The picture is for New York, the beginning of 20th century. The second soil transmitted element is Trichuris trichura.
Just I have a question. Some research says if you have two different parasites, one of them is scarab, okay? You should to treat scarab first, because if you treat the second one, the scarab become more crazy and more vital.
Yes.
So this is true?
It's true. When you are at the same time, mixed infection is the matter. You have to kill let me say that, the resistant one for the first time. Because maybe during the treatment for the second one, it become, as your friend says, it become aberrant and go to, for instance, lumen of appendix or penetrate the intestine. So you have to think about, for instance, at the same time, and if you have Trichuris trichura and Ascaris lumbricoides, you have to treat Ascaris lumbricoides, because the dosage of therapy is higher than that one. So through this first priority, you may treat even another one. It's very important. So I will mention this better when we will talk about the third one here. For Trichuris trichura, Trichocephalus humilis, thank you for the question, it was very good. And we perform infection. Why? Because the shape of the egg, of the worm is like white when, if you remember, in horse riding or something like that. So again, this is female, this is male. Geohelminth, soil transmitted helminth. This is in size, they are around 3 to 5 centimeters in length. But for Ascaris lumbricoides was nearly 13 to 14 centimeters in length. And you can see here that anterior end of both female and male are very spiny in shape, and they can go and fix themselves into the intestinal lumen, and despite the Ascaris, which just relied on the muscle of the tube-like muscle of the body. Okay, again here, the morphology of Trichuris trichura, weight form, male around 3 to 4 centimeters, and for female a bit larger. And you can see here that the eggs are very typical. By first observation, you can see this egg tomorrow. By the first observation, you will never forget the egg and the shape of the egg, and you can diagnose. So, yes, that's all. This is the male one. Posterior end of the female is, you can see just one spicule. Despite of Ascaris, we had two spicules, one spicule. Worldwide distribution. Wherever on that time you recorded, for instance, 1 billion people infected with Ascaris staphylococcus, the second one was Tracheides trachea with 800 million people. So mixed infection, as your friend mentioned, we expect very easy to have seen in everywhere. Worldwide distribution, again. The history of Tracheides trachea is backed, by microscopical examination back to 300 years ago. But I'm sure that even if you can find samples of 10,000 years ago, okay, or 20,000 years ago, you can again, sorry, it was belonged to 300,000 years ago. Even in very far time, you can find in very far past, I'm sure that the parasite should have been existed. Okay, the morphology again. For Tracheides trachea, the esophagus of the parasite is not tube-like. It contains of esticocyte, and in total we say esticosome. I don't know the name of the English name of tasbih. The tasbih.
سبحة.
This as he says, you can see that each of them is one esticocyte, for instance, and this thread connecting them together is the channel that by putting all these up to each other, okay, you may see this structure, and this is esticosome. So, a very good example for showing the morphology of the esophagus of aphasmid worms. They are aphasmid worms, phasmid and aphasmid worms. So this is the picture from our professor, Dr. Sajjadi from Shiraz University, very nice man. And this is by this picture in the site of parasitic infection. You can see the difference between esophagus of aphasmid worms, the two phasmid worms. Two aphasmid worms we have here now. Tracheides trachea, and the next one, Trichinella spinax. Okay, life cycle. All parts you can see in the picture for Ascaris lamblycoides is similar in Tracheides trachea, except one. Respiratory migration is not here. Respiratory migration in the beginning of ingesting of larval eggs, okay? When they enter to the small intestine, the eggs become broken and the larva is free, and then after try to keep themselves into the intestine. But the second difference is that the location of Ascaris lamblycoides in the small intestine, this is in large intestine. By spending some months to become adult, they reach to the large intestine, nearly even to the transverse column, ascending and descent column, and nearly the rectum. and as they attach themselves by the spiny head of the anterior portion to the intestinal wall, the reaction is very severe. So young children, when they want to defecate, maybe the part of rectum become out and rectal prolapses happen. It's very unexpected, but is defined in tracheostomy trachea. After 2-3 weeks, they become embryonated, infected. When they expel by the feces outside, the eggs become infected after 2-3 weeks, like what we talked about, Oscaris gammaequatus, hatching in the intestine. The infected larvae penetrate the villi and continue to develop in the small intestine for some time. And then after, they migrate to the large intestine. The young worms move to the ceca and penetrate the mucosa, and there they complete developmental stage to adult forms in the large intestine within 3 months. So imagine that on that time, or where you can find the very polluted area and hyper-endemic area, you can, with poor hygienic and economic situation. At the same time, the 10 years old boy or 5 years old boy or girl is carrying hundreds of, tens of Oscaris and tens of Tracheostomy trachea. What would be their situation? Very bad situation. Clinical manifestation: gastrointestinal systemic, anorexia, pica, tendency to eat soil. You may hear that some pregnant woman or somebody trends to, they like to taste the soil, for instance. Anyhow, anorexia, pica, lower abdominal pain, mucoid diarrhea, dysentery, rectal collapse. And what is the systemic? In chronic phase, iron deficiency, because by this very teeny and spiny anterior port, they may cause bleeding into the intestinal tract. Anemia, linear growth, retardation, clouding of fingers and toes, body wasting if dysentery is severe. These two should be due to anemia as well. So systemic clinical manifestation is also very important here. Rectal prolapse. And the mother on that time, they learned to how to replace the rectum in the previous location. So with a towel, warm towel, and make it wet with warm water. Very slowly they could replace back the rectal to its normal location for their children. This is the worms on the rectum. Tracheostomy dysentery syndrome, TDS. If the patients are carrying more than 100 worms, they may face with heavy infestation with tracheostomy. Seen in children present with mucoid diarrhea, rectal bleeding, rectal prolapse, and others. So this manifestation has traditionally been named as tracheostomy dysentery syndrome, TDS. Nervousness, headache, insomnia, impaired cognition, loss of appetite, vomiting, abdominal distension, emaciation, appendicitis.
Those symptoms of the syndrome, right?
What?
The symptoms of the syndrome.
Yes, no, this is when you are facing to more than 100
Yeah, I got it.
worms. Yes. Laboratory diagnosis, finding these very typical eggs of around 50 to 55 micrometer in length under the microscope with these two very prominent holes. Very prominent, this one and this one. Very diagnostic and characteristic. Like for ascaris, we have to sediment the feces with formalin and ether, and we can get the eggs in the sediment material by microscope. And also this. For treatment, exactly like what we prescribe for ascaris staphylococcus. Albendazole 400 milligrams single dose in a heavy infection up to 3 days. Because here you are facing to invasion to the tissue. So you have to be enough conscious, you have to be enough confirmed that your treatment was effective. Prevention and control. Exactly like what we described for ascaris staphylococcus, according to similar transmission pattern like ascariasis. Okay. Now, let me see that yes, we have 1 or 2 worms left for this session and 4 worms for the next session. Now I think that we decided to go for a very hard job today. 4 sessions, nearly 10 to 12 worms, but from now on, this is not for you, for those who will come after you in next year, and maybe I cannot come here for many reasons, but I will suggest to my friend to in table of content, I mean, this class should be delivered in 3 days, I think.
Yeah.
In 3 days, 3 or 4 warm and practical in 3 days. This is good.
That's why I said that we got a practical session and then complete tomorrow. Like.
And now,
Yeah.
I asked them to stay at home.
That's no problem. It's okay.
Again, we go to the bazaar and yes, for
Yeah.
cities. Then, unfortunately, if you talk in subject, trichinosis, or due to Trichinella spiralis. Soil transmitted helminth finished. We have still 2, 3 of them, but in the next session. This is food transmitted helminth, meat transmitted helminth, but not by the meat of cattle or sheep or goat. By the meat of pork, swine species. Okay? Trichinellosis. Trichinella spiralis species is the common cause of human disease by eating raw or undercooked pork. Nobody prefers to cook khoresh kayme, for instance, or khoresh sabzi by pork. They just prefer to eat as a steak, very juicy one, so the risk of infection transmission is very possible. Females 3 to 5 millimeter, 4 millimeter. Males around 1.4 to 1.6 millimeter. In nematodes, males are always smaller than females. And despite of other 2 nematodes and all nematodes, we have not a spicule in the posterior end of the male worms. We have here flaps. 2 flaps.
What is this? Without. Hey.
Right.
This is something
doctor.
Okay, so this is the male form and this is the female form of Trichinella espilaris, and this is the structure of esophagus. I told you as a stegozoa. Okay. The map of the board and showing you that this infection can be is distributed everywhere where the people are intending to eat the pork. Life cycle. Again, human here. What is the infective material? The meat of infected pig and the infected swine animals. Is Susa scrofa, for instance, the white pig. Rodents, why? Because rodents can eat something residual material in the sheep, in the pork keeping places, okay, and or slaughterhouses, and they can get the infected muscle with larvae, and they become infected. In our experimental pathology work, we tried some years ago to keep the larvae in the laboratory mouse. It was very easy for us. And during these slides, I will tell about this important matter. So when you get the infected muscle of the pork as a hamburger or as kebab or a steak or something, in the stomach, the muscle become digest and the larvae become free, and they try to keep themselves into lamina propria and to mucoid layer of the intestine. After some days they become adult, copulation happen, and they are not egg oviparous, they are larviparous. So they release larvae instead of eggs. And there's several number of larvae may release from the uterus of the female worms, and these releasing larvae, most of them can go outside the intestinal tract, producing acute diarrhea, which is the first clinical sign and symptoms of trichinosis, diarrhea, acute diarrhea. They go to the hospital at night to ask them, okay, since early morning till now I had tens of times diarrhea, and suddenly they can find that their friends also are over there. Why? Because in the same ceremony, in the same picnic, in the same diet, they had hunted swine or pork they ingested, and they get infected altogether. So this is the first phase, acute diarrhea. And some of these larvae that are not still from the intestinal tract, they decided to go into the intestine, into blood circulation. So the second phase is now toxic phase. So here you have edema, you have some hemorrhages around the nails, and this is something as a toxic condition. And they try to reach themselves to the final destination, which is muscular cells, muscle cells, and muscular system. If the patient is enough lucky and the larvae are not invading to the CNS, central nervous system, to make them paralyzed, okay? So they may enter to this third phase, which is muscular pain. Very bad pain that are not respond to the normal analgesic material. So for humans, this phase this is the dead end. Because after some months they become calcified and okay, the disease is finished. But for animals, for carnivores that may get infection and even the pork, they may get infection similar to what I talked about the humans, okay? The condition is not the end because the larvae is forming in the muscle cell of dogs, wolves, jackal, foxes, and others, and even the porks, pigs, and then after they become hunted by other carnivores. Maybe they are killed accidentally in the wildlife or on the road and somewhere, and the other meat-eating carnivores come to the carcasses and get another infection. So the circulation of this parasite passing to between the carnivores is continued in the life, in the wildlife. The life cycle here, you can see here, human, all these animals can get infected, can get the worm. You can see here wolves. One type of Trichinella is due to eating infected meat of horse. In France, they import some type of horse from the United States that can be infected with Trichinella spiralis, and Trichinella, I think, I forgot the name, Trichinella atii, no, Britovi, no, Britovi. Another type of Trichinella. The important is that it can be transmitted by infected meat of the horse. Mainly the number is recorded in France and the United States. So this is the life cycle. And acute phase is this, diarrhea. Second phase, toxic one. Third phase, painful muscles. Okay? Trichinella spiralis diagnosis, indirect methods. Nobody can diagnose Trichinella in the first phase of diarrhea. They can say this is some, I don't know, bacterial infection, or in the time of COVID, all symptoms and all signs could be related to COVID-19. But now the condition is changed. So the important is that the history for the patient is very important. She or he should honestly tell you that what was in the last night or 3 days ago food item. Have they even consumed the pork or not? Or have they consumed the hunted material or not? This is very important. Eating pork 2 weeks earlier or recent gastroenteritis. Blood examination, eosinophilia, you have here tissue invasion again. So eosinophilia is expected, and muscle biopsy. Very rarely the physician asks for muscle biopsy. Trichinella infection are most often diagnosed in the laboratory based on detection of antibodies in ELISA tests. In Beirut, in Lebanon, 35 years ago, a paper published by a parasitologist, very nice one, very important one. He decided to examine trichinosis in rural areas of Lebanon, living Muslims, Jews, and Christians at the same time. As you may know, Muslims and Jews do not not
Pork.
pork, okay? Just Christians. So on that paper, the trichinosis was just diagnosed among Christians, not Jews and not Muslims. But nowadays the scenario is something very exceptional. You know, everybody wants to say, okay, this is me and what my grandfather says about pork. I want to test it. Or maybe they are just Muslim on the paper and they can test something.
There is a lot.
What?
There is a lot.
There is maybe, but nowadays, the observation and the dealing with patients must be different. I asked from one of the patients in my laboratory, have you consumed pork? Pork? But he was. And Dr. Kia, my colleague, will come to you. I think 2 months later, or 1 month later, she diagnosed the first intestinal, in the first trichinosis in Iran after revolution, and the case was very important, and asked her to explain it. But she is here for cestor. She is here for cestors. Anyhow, when you go to European countries, in the bazaar you can see plenty of carcasses of pork over there, but no infection over there. Why? Because the because the managing system in slaughterhouses are well screened, and they do not allow to suspected meat to go to the bazaar. But in other countries like some parts of Africa and some parts of South America and some parts of Eastern Europe, the condition is something else, because hunting is legal and they go to hunt Sosis scrofa over there and get meat, and this is such possible. For treatment, albendazole 200 mg 5 days, but albendazole 400 mg 3 days. According to WHO, prednisolone also can be described for elimination, for inflammation, because you have inflammation, and to help the people and to make your treatment effective enough, along with albendazole 400 mg for 3 days. Okay, it's better to prescribe 40 to 60 mg prednisolone according to WHO guidelines. For prevention, is it something hard or difficult to guess what is the prevention of trichinosis?
No, it's easy.
First,
Nothing.
become Muslim?
Stop. Yeah. So it's important.
No, honestly, first, ask not to eat, for instance, hunting materials. If somebody are allowed to eat pork, they have to be conscious that enough undercooked suspected meat are the source of infection.
Raw meat.
Raw meat also. And the other material is to regulation in slaughterhouses. And yes, that's all. Okay.
I have a question. Is it possible also to infect it from another meat, like not pork?
No,
For example.
up to now, no.
So why?
For which type of animal?
So why you say like we should not like eat the hunting material?
No, I'm not talking about I don't know, goose or something in the wild, like for example, white sheep or white goat. I'm talking about white pigs.
Oh.
White pigs
Got
is Susa scrufa. In Farsi we say goraz.
Yeah.
Susa scrufa. They are everywhere. Even in Baghdad Abbas you can find in mountainous area.
Yeah.
In jungle area. In some place. In the northern part of Iran, with the stump province, for instance, 10 years ago, 20 years ago in Khuzestan province, for cane sugar field, they were preventing their fields from access to the wild pigs, Susis Krufa, because they were destroying the system. I examined 40 carcasses of wild Susis Krufa. This is very important. Okay, and here again, the best way to prevent trichinosis is to cook meat carefully to save temperature. I remember some years ago, Christian people were coming from Shahreport province in Iran, and I was accidentally in a mechanical area, and I asked them, what is in your car? And they told me we were in hunting, legal hunting, and this is Susis Krufa. And I asked them, how do you use it to prevent trichinosis? He told me that we keep it first in the refrigerator for 2 months, and then after we use it. This is written in the referral books. But one experience I have that I was looking for the trichinella, and in news I heard that panther was killed in Ardeni province. I asked from my colleague to get some sample from the Panthera pardus saxicolor, one panther in Ardeni, and it was infected. We published the paper as trichinella in Panthera pardus saxicolor in Iran. I kept some of this material in our refrigerator for 2, 3, 4 months for another experimental surveys. And very surprisingly, we found that it was infected even after it was capable to infect laboratory mouse after 4 months in the refrigerator, in freezing condition. I get it out and make it available for laboratory mouse, and after 1 month we found that these mouse were infected. So it means that even keeping the infected meat into the refrigerator is not very definite decision. So, and the last one. The last one is direct transmitted helminth, Anthraeus vermicularis. Pinworms living around the perianal, inside the colon. They are also male and female, separated one, and the size is very tiny, less than 1 centimeter. The very important biological trait of this parasite is that the females, for laying eggs, do not lay their eggs into the intestinal tract. They try to go out around the perianal at night, lay their eggs, and come back again to the large intestine. Until recently, we thought that itching around the perianal area is due to these moving worms. But now we believe that the excretory materials by the eggs from the uterus of the females is producing this reaction. So the only important signs and symptoms of Anthraeus vermicularis is perianal itching. Very important. So Anthraeus vermicularis, pinworm, sitworm, or Oxyuris vermicularis, direct transmitted helminth. This is the male one, female one, this is the male one. Very small one, the male. Up to now, I could not find the male one. The infection, the status of infection in nowadays is not so related to level of education, level of poverty, level of hygienic matters or something like that. Because even if you go to Scandinavian countries, if you go to London, if you go to Iraq, to Afghanistan, to Iran, and you ask the physicians and laboratory technicians that have you seen recently the number of infected people with intravenous tuberculosis? Yes. Because when they are get together in institutional situation like kindergarten, like school and somewhere, and they are touching each other, they are touching the toys materials and writing materials, they can transmit the eggs to each other. When preanal itching is happening, the boys, the girls, at time when they are in a sleeping camp, they try to itch them around they touch around the perianal, and the eggs are under the nails, and they are, okay, this is the early morning, and maybe you can see some babies, they are sleeping like this. And auto-infection is possible for anthrobiasis. And even the mothers and the fathers, their relatives can get infection by kissing them when they are, oh, how sweet boy, how sweet girl, and they may get the eggs from it. The time for eggs become infected is 6 hours. From the early night up to the morning, okay, the eggs become fertile. So they go to the school, to the kindergarten, to medical classes, and they touch mobile phone and something, okay, and they can transmit the eggs to the others. One of my professors asked me by which vehicle you came from your house to when I was a PhD student in the university, by taxi. Which type of parasite might be transmitted within you and the driver of the taxi? I was silent. And he mentioned that enterobiasis is very important. Maybe you gave money to the driver, and he back to you some other eggs of enterobius vermicularis can transmitted by even by coin to the others. So the egg of the parasite is very important. I told you that the eggs are not laying into the intestinal tract. So a stool examination is not useful. You have to get scotch tape sample from the preanal of the patient. Before going to the toilet early morning, the mother can help you, and you can see the preanal of the baby and the children. This is not related to children, even adult one. And you can get a piece of scotch tape, put it here, and get a print. And this, when you put it on the microscopic slide, you can see the eggs under the microscope. Very easy to detect the. Even one of my professors performed a thesis between the students to go and in the schools, they get the nail of the school children, and also scotch tape from the handle of the doors, and also the handle of the toilets and the valve of the toilet, and they could find the eggs of enterobius vermicularis very, very easy. So this is very important. Maybe you can go to the metro, you can go to the buses, and you get scotch tape from the handle of this instrument that are over there for keeping them to fall. Female about 8 millimeter to 1 centimeter, and male is only 2 millimeter, and also very, very characteristic feature for diagnosis of this parasite is cephalic ali. Although infecting with enterobius vermicularis is very important, even by preanal itching and something like that. But the most dangerous scenario for introduced vermicularis is appendicitis. Why? Because the worms are living near the appendix, and then they go to the appendix lumen and produce acute appendicitis. So because of this very dangerous consequence, you have to detect the patients and you have to treat them because they are facing to possible appendicitis, which may submit them to the operation room and is very dangerous. Anyhow, from the pharyngeal loop, in tissue sections, when the pathologist get the appendectomy material from the surgeon and they cross section, they make prepare the tissue section process. In cross sections, this very characteristic cephalic ali, which is continued throughout the esophagus, is very helpful for conferring the infection. Retroinfection. Mode of infection from anus to colon. From anus to colon. It means that after 6 hours, when the eggs become infective, the shell of the egg become broken, and then after larvae again go into the colon of the same individual. It means that this is retroinfection. Eggs laid on the perianal skin immediately hatch into infective stage of larvae, migrate through the anus and develops into worms in the colon. For the female patients, for those very for young daughters and young girls, even egg can go into the genital organs, and then after years you may witness a granuloma around the genital organs, and this is due to the migration of mechanical migration or going the larvae from the perianal area to the genital organs. The pinworm are one of the most common intestinal nematode. The adult worms inhabit the ceca and colon right after mating. Okay. Epidemiology, cosmopolitan. At any socioeconomical level, families with 2 or more children can expect at least one bout of enterobiasis. Tends to spread in social group. Families, summer camps, institutionalized persons, poor personal hygiene, overcrowding, and substandard sanitation. When you go to an institution and you see 200 children are over there, okay? And if one of them is infected, within 1 week, all of them may get introduced vermicularis by touching the handles, the vehicle, the instrument, and everything. And nowadays by mobile phone.
Is it possible to kill the larvae by sterilization, like?
Yes, what is sterilization? It's exactly as when you, in the COVID-19, please, in COVID-19 period, the number of patients with the number of enterobiasis was reduced. Why? Because shaking hand was prohibited. Because mask and eggs are, maybe the eggs are in the air. Why? When the mother or when he or she is sleeping on the bed and they want to put it like this, okay? And the eggs are around. So in the time of COVID-19, one of the researchers in the European countries, they decided to perform such. Unfortunately, I could not help him, and two separate study in Turkey and in some places in some countries in Europe, they performed that during by preventing method for COVID-19, okay? They also, you remember when in COVID-19, even for this bottle of drinking water, when somebody brought it and bring it into their house, okay, alcohol, I think many material they used to make it clean in their mind, and also kissing was prohibited. Even I remember that I was going to S1 city and to other places to meet my relatives and to meet my mother even. Okay, I prefer to not to kiss him, to kiss her, because maybe COVID-19. So by these four or five means of preventing COVID-19, exactly introduces also was declined. This is very important to take into account. In Northwest Europe and in the US, prevalence rate can be seen up to 100 cases, 100%. Why? Because this is a direct transmitted habit. And yes, no, nothing is left here. Life cycle in the large intestine, adult forms, eggs around the preanal area, and by touching the eggs, or many other ways that I explain here more than necessary, okay? You may have, again, the larvae form inside the egg, and they are the cause of infection. Okay, clinical features and pathogenesis: pruritus and eczematous dermatitis, restlessness, irritability, emotional instability, allergic reaction. I described all of these specific points in my general talking. I think that it's not necessary to repeat. For symptomology, about 1/3 of pinworm-infested persons are asymptomatic. The adult forms may cause slight irritation of the major symptoms in anal pruritus, but appendicitis was very dangerous. Granuloma formation in vaginal wall, in the cervix, endometrium, that I talked about the possibility of putting the eggs by themselves, or even by mother when the mother wants to wash the female children and young children, and they may put the eggs into the genital organs. So this is very important. But in male and female, granuloma in peritoneum, liver, kidney, and lung is reported. With my professor, we reported one introduced verticularis case in the eye of one school children. Because after some days, we concluded that by touching the lacrimal sac here, they put larvae inside, and then after worm was over there. I asked one of the ophthalmologists for laser and something, and they wash into the material, anti-emetic material, into the lacrimal sac, and it was also the case. This is very important. And yes, this is the appendix, appendectomy material in pathology, and this is pathological section, and you can see here, this is the cephalic area of worm that I told you, very important in morphology, using to diagnose the forms in histological sections. A diagnosis, Scotch tape, okay? Clinical models always diagnose enterobiasis sooner than physicians. Why? They know that the babies are, I don't know, they touching their anal area, and they are disturbed and they itching and something like that. Okay, so because of this observation, they bring the babies to the physicians. So, Scotch tape, anal smear showing large number of interviews eggs under the lower power in the background and clinical, and also this procedure is called Graham's Scotch tape. Graham's Scotch tape. Yes. Treatment. Albendazole, 400 mg single dose. But you have to be enough confirmed about your the result of treatment, because appendicitis is very important. So 2-3 weeks after that, it's better to again examine, and if the signs and pruritus area is still existed, and the mother says similar matters, and also you can find the eggs, you have to repeat the treatment. Okay, control and prevention. I'm sure that you can now say better than me the prevention. Keep fingers out of your mouth and nose. Keep fingernails short, and do not bite your nail. This is a suggestion to recommendation to all of us. And also wash your hands, change clothing, towels and sheets frequently, and wash them in hot water during, if you see that you have an infected person in your family, in your house, okay? This is definite expectation that some days later you have to see all of your family members are infected. This is very important. This is why if we find a person infected with this worm in the family, you have to treat all family members. Very important. And according to...
Is it fatal?
What?
Is it fatal or no?
No, it's not fatal. Appendicitis is fatal. It's when if you are not enough aware about that and the time lost, yes. Anyhow, 5,000 eggs were detected on the wall of the school hall, classroom, and laboratory, respectively. And I also have such similar experience. Okay. That's all. Thank you, and sorry for such model of talking. Anyhow, this is 4:15. I think it's better to continue when? Tomorrow.
Yeah.
You know, but it's very secret, because